So you mentioned the benefit for the patient of actually being cautious with antibiotics. And I think that even though it's in a utilitarian sense, it's shocking the potential for AMR to cause so many deaths globally. I think to people that's a statistic. Is there a way to sort of personalize the complications that inappropriate antibiotic prescription can lead to? You mentioned your own experiences, but I know issues like sepsis, C. diff. There's a lot on the table that the public doesn't know very much about, and you hear the phrase "powerful antibiotic" a lot, or "we're going to prescribe a really strong antimicrobial," and there's ways that might be a misnomer.
Yes, yeah, absolutely. I mean, there are no strong antibiotics. There are antibiotics that work for a particular disease and a particular pathogen in a particular circumstance and a particular place and patient, right? And so I think, and as you mentioned, language is important in this respect, and it's important as healthcare professionals that when we communicate with patients, we make sure that the language also reflects that reality.
I'm going to just open the floor to some closing thoughts from you. Anything that you think the public or clinicians would be interested in knowing about these efforts with antimicrobial stewardship from Pfizer? And also, if you have any connections to the ongoing coronavirus pandemic, particularly you mentioned there's parallels between a world with heightened antimicrobial resistance and the world we're living in now. Is there information about overuse of antibiotics in COVID patients? I mean, I'm sure a lot of that is going to be anecdotal for the time being, but are there concerns in the immediate sense when it comes to the coronavirus pandemic, SARS-CoV-2, about AMR?
Yeah. So as you mentioned, we don't have data or sufficient data yet on this, and actually this initiative will help us in part to gather some data in sub-Saharan Africa related to COVID-19 and the use of antibiotics. And there's a parallel there's a couple of parallels. One of them is that, of course, COVID-19 affects patients who are actually also very much affected by infectious disease in general and very sensitive to resistant strains, or very much exposed to resistant strains. That's definitely one parallel. But the other one, which you alluded to as well, is that COVID-19 really shows us what the world looks like without effective antibiotics. And it really shows us what an impact that has in terms of human suffering and death, and also more generally in terms of human interactions, economic impact, and so on. So it really shows us what a world without antibiotics looks like, where people can die from minor infections, or a lot of surgeries, for instance, that we're used to today would not be able to take place anymore. We haven't talked about cancer treatment, for instance. Cancer treatment in many cases is impossible without functioning antibiotics. And so I think that really paints a very bleak picture, and again tells us that what we're doing is really very important, and we should continue doing it and amplify it as well. In terms of the low and middle income countries, actually, we have a number of initiatives that I haven't mentioned before, but trachoma is a leading cause of blindness, which mainly affects people in low and middle income countries. For many years now, we have had the International Trachoma Initiative, where, again, a public-private partnership, where the intention is to eradicate trachoma. And we've already achieved, together with our partners, eradication in a number of countries, and we continue that program. We've also working very closely with Gavi, with the Vaccine Alliance, to provide our vaccines to patients in low and middle income countries, and also we have many different grant programs, some of them for antimicrobial stewardship, for instance. and also charitable grants related to COVID-19 as well. Now, if you would say, what is the overall message for this, is that in addressing antimicrobial resistance, my sense is that really we cannot do this. Nobody can do this on their own. Governments in the different countries cannot do it on their own. International organizations cannot do it on their own. Pharmaceutical companies cannot do it on their own. Physicians, etc. It really has to be a joint effort, and that's why public-private partnerships like SPIDAR are the one that we were talking about in terms of surveillance are so important, because it's only when we all work together to really address this problem and address it now that we will be able to solve it.
One last question that you inspired, which is how regional versus global are the ramifications here? Because I think people may hear, despite the global implications, they may hear sub-Saharan Africa if they're in a Western country, Northern Hemisphere country, and dismiss it, right? But what happens in one link of the chain with antibiotics, even though there's regional differences in resistance, doesn't that affect the whole cycle?
Absolutely, and we've actually seen this again with COVID-19, right? It started in China, it affected countries in Europe, it affected the US, Iran. There's a significant expansion now in Latin America as well. The world has become a much more connected place than it's ever been, and so we see the effects of this with COVID-19. Similarly, with antimicrobial resistance, if there are resistant strains in a particular country, in time those resistant strains will come to where you are. And we have seen this actually already with quite a few resistance mechanisms that initiated in one particular country in Asia and are now widespread in either Europe or the United States, and vice versa. And so that's why this global approach is incredibly important.
Well, thank you for your time. Thank you for the efforts at engaging civil society in this issue. It's, like you said, not something anyone can do alone. Thank you again, Dr. Vandenbroucke.
Great. Thank you very much.